For those joining us just now, one of our presenters will be speaking in French. So we encourage you, if you don't speak French, to get an interpretation device. Thank you. We're good? Thank you. We want to welcome you and thank you for being here this afternoon on the last day of this VARN 2023 conference. And we are going to talk about stories and about communicating and about how important it is to talk to journalists. And I have here with me some amazing colleagues who are going to share information with you, but we want this to be a very candid, interactive conversation. We're going to ask you questions, and we are going to welcome your experiences, anything you think might be helpful to share with us. And so I'm going to talk a little bit about my colleagues here. Ana Bottallo, who you probably saw in the plenary today, she is a scientist and a journalist from Sao Paulo, Brazil. And Ana also participates in an organization or a program called InfoVacina for early career journalists and experienced science journalists. And Patrick Kahondwa is a science journalist and chief editor of Sciences Médias d'Arce, SciDev, in the Democratic Republic of Congo. And he is also a regular contributor to VaccinesWork, which is a blog Gavi keeps. My colleague Jaya Shreedhar, she is a medical doctor and a media trainer and a journalist working with Internews, currently a partner of Sabin. And we want to start with Ana. If we can load her presentation. Thank you.
So good afternoon, everyone. As Nadia here said, my name is Ana Bottallo. I'm a science and health reporter for Folha de Sa, which is the largest media outlet in Brazil, based in São Paulo. And well, the theme of our conversation is how to tell your immunization story to a journalist and why. And I'm going to talk about the perspective of Brazil's COVID pandemic. So first, I'd like to pose the question, what is scientific journalism and what is a science journalist? So before the pandemic, pre-pandemic time, we had science journalists that were covering mainly astronomy, human evolution, sci-tech, maybe biodiversity and environmental issues, and of course health journalists were focusing on services provided by health public and private health services, well-being, how to balance your life, new drug therapies and discoveries, but not focusing really on the scientific part, more on the how to get to new drug therapies or how to better have a better health in your life. And then with the COVID pandemic, a lot of newsrooms had to adjust and to adapt and had their journalists that are currently covering politics or economics or daily news to cover the pandemic. So I think that from that we can start saying that it is difficult to have science journalists when you don't have them trained to address the issues of science in the large outlets, media outlets. And one of the things is that we learned from the COVID pandemic on a daily basis. So if anyone here was covering the COVID pandemic in the early 2020, we made a lot of mistakes because we didn't know what was going on and how long would the pandemic take. So one of the headlines that we posted in March 2020 was this one. So use of protective equipment, or PPEs as we call, they are not meant to protect us. They should be left for the healthcare professionals. And this was something that even the WHO advisor said, we have to keep them because we may have shortage issues and we may have problems, and they are not going to protect people because we thought that the virus was transmitting through our hands or maybe close contact. We didn't know anything about airborne transmission. But the problem is that when we talk about science communication, we must say that this is the most recent evidence-based information we have, because when we have to correct those mistakes, we have to say that was what we knew then, and now the information has changed. But because many people didn't do that, we have still to this day people saying that the virus is a lie, or that COVID doesn't exist, or that it doesn't transmit through airborne. And we know that that's not true. But it's important to be 100% transparent and to even humble to recognize our mistakes. So remembering our first contact with the virus, there was a lot of information coming on from the scientific community on how this virus was different from other SARS that made other outbreaks in the past. And we didn't even know if this virus would mutate in a high rate, or if it would provide natural immunity after infection, or how long would it take, or how many infections can one person have. Now we know we can have reinfection. All this information was very new, and we were reporting it on a daily basis. And it's hard because you have to talk to the scientific community, you have to read the papers, and you have to report it in a time that the people are asking for more information because they don't know what's going on. They see their loved ones being infected and dying. We also had a very different range of disease. So we have people that were dying from lung failure and SARS, the respiratory acute syndrome, and we had people that were asymptomatic. So it's very difficult to balance how we report. And of course, with that comes the communication of scientific concepts, which can be very difficult. So as Nadia said, and if you were participating in our plenary session earlier, I have an undergraduate in biological sciences and a master and a PhD in zoology and paleontology. So I was already engaged with the science and biological concepts behind virology. But many of my colleagues in newsrooms worldwide didn't know the first thing about a virus, or how to communicate about evolutionary rates, or some how the virus infects our cells. So all of these are concepts that's very difficult to grasp. And even if it's difficult for us to grasp, imagine for the main audience who have never thought of how a virus works, or how a cell infection can happen. And of course, we had a problem. Here is just to show those two slides. They show, for instance, the cumulative case and deaths. And in the right side here in Brazil, we were rolling. We saw the deaths coming, and we saw that people were hospitalized, and we didn't know how long would it take, for how long the COVID pandemic would still last. And with that comes the more interesting of the people. They wanted answers. They wanted to know when it's going to end. How many waves are we going to have? Is it going to mutate? Can I get reinfected? All of those questions, which were very, very pertinent, and we didn't have the time at the time the answer to most of them. So we had to also calculate how to transmit that message. And here, I don't know if most of people here know, but in Brazil, in the last 4 years, we've had a far-winged, the scientific denier president, and he also collaborated with the virus. So in Brazil, we had situations like this, when people were dying in their home because they could not get access to hospitals. They could not get care for their families, and they were dying. And people was desperate because at the same time the president was saying that this was just a little cold, that this was nothing, you should not worry, you should go to your job, you should go out, don't stay home. So all of this was also contributing to our communication on the pandemic. So this is just to show one of the situations we had in April 2021 when we had to bury people in collective, I don't know how you'd say, graves, yes. So very tragic situation. And this is our former president. So he was also saying a lot of things that we have to go and fact check and say, that's not true. But when we as media don't have the people's trust and the president or the authority in the country has, it's very difficult. So just to show some of the headlines that went out to say, you know what the president just said at the TV? That's not true. Remember what he said last week? That's not true. You know what he meant about how children will not get infected? That's not true. Lots of children got infected and died from the COVID in Brazil. But we also had all of these people that were believing in what he was saying. It was very difficult to balance this. And of course, it began with what we are here to discuss, the immunization. So in mid-2020, they started the vaccine development, and then we had worldwide enrollment of clinical trials. And this was a first for everyone, because I don't think that in any other time in history, people followed a race for immunization as closely as they did with the COVID pandemic. We were rooting for it as it was the end of the World Cup or the Olympics. We were hoping that the vaccines would get there as soon as possible, and we were comparing vaccine platforms and vaccine efficacies, and this is something that, as well as it could be interesting for engaging with the public, it's also very harmful, because the clinical trials, they are important for the health regulation agencies to approve the vaccines, but not for people to make their decisions on whether they get vaccinated or not. Nobody ever thought before the COVID pandemic how efficacy was the flu vaccine, and we all got them every single year, right? So this was also very dangerous, and I think this was one of the things that the media coverage worldwide, one big mistake that media coverage worldwide made within the pandemic, and this has results until today. So just to make here the example that we had every single day people saying, we now have 157 vaccine developments. We have 3 that are approved and 5 that are nearly finishing their clinical trials in phase 3. So all of this was a very confusing and most of the times information that the public didn't have access before. So it's hard, again, to control how we can be excited about it and how we can just try to moderate people's excitement and anxiety. And also, it began to compare vaccine platforms and vaccines from different pharmaceutical companies. Also, this was very harmful, because when we say that the clinical trials and the vaccine that was developed in such country had 95% efficacy, this is based on a very specific public that attended the clinical trial during a specific period of time with a specific rate of infection. That does not mean that everybody that got the shot would have 95% efficacy against infection. And that message came out wrong. That message came very, very wrong. Because then when the other vaccines that were approved had 50%, people would say, well, why am I going to get the 50% one if there's one that's 95%? And that's not what we must make the people get from the vaccine development, because all vaccines are efficacy if we get all of the population immunized. So just to show here, one of the main problems that we had is that we were comparing vaccine efficacy. And we did that as media outlets because also the public was interested in knowing when the clinical trials would end. And we had some problems with political intentions, because when people think that if that vaccine that's made from the Chinese platform had an efficacy that was lower than the one from the USA or the European country, people are going to start thinking of conspiracy theories or things that nobody ever thought before. For instance, where do the pharmaceutical companies come from? And where do the IFA comes from, which is the ingredient that makes the vaccines? And of course, we had some bad communication, even from health authorities and from people that worked in those pharmaceutical companies, such as saying that, the vaccine was 100% effectiveness against death. That's not true. That was just in the clinical trial with a very low number of people that died from it. So we could not say to people, you're not going to die if you take the vaccine. We should have said, you are going to have a much lower chance of having a hospitalization and maybe in event of death if you get vaccinated. But that message was totally wrong, and when we tried to repair it, it was already too late. And we even have some political intentions that were working to get their intentions out there with the vaccines. For instance, in Brazil, we had a very, very big dispute around the vaccines. So we had the President Bolsonaro, which didn't believe in vaccines at first, and then changed his discourse to discredit the Chinese vaccine and say that the British vaccine was better. And so this was very confusing for people, because then it became a question of ideology and of political choices, not a question of what do you make decisions to your health or your to prioritize your health or the health of your beloved ones. And we had, with that effect, low coverage worldwide. We have, with that effect, low coverage of booster vaccines worldwide. And all of that affected the routine immunization, as we said earlier. All of that affected vaccine acceptance that was never a problem in Brazil and in other countries as well. So what I want to end my presentation with is that we have to be at all times ready to say the right message and to let people know that what we have is the most recent evidence-based information yet. Then we have to adjust it when the clinical trials or the researchers change. We have to adjust that discourse. Because if we say something and we say that this is immutable, or if you're not going to have to get booster shots because, oh, you take 2 shots and you're done, that's not true. We saw that after. Or, oh, we're not going to have side effects with the vaccine. That's not true. You could have side effects, but you have to say to people what they are going to expect and not try to hide information from them. So I just wanted to finish saying that when we have a very strong connection with the scientific community, with the healthcare practitioners, with the Ministry of Health and the authorities, we are able to communicate to people what is the importance of getting vaccinated? What is the importance of talking about side effects of vaccines? What is the importance of talking about how do clinical trials work? What are the different platforms? What does it do to get you immunized? And then just to finish, this is a photo I took from a presentation that happened some weeks ago, showing that actually our problem with low vaccine coverage started around 2015, but it plummeted with the COVID pandemic because, as I said, that affected people's trust. And when the people's trust is affected, it's very hard to regain trust. So here are the numbers of 2022, very low coverage for most of the routine immunizations. I know it's very, very small here, but just to show that none of them achieved 80% high coverage. And so just to clear up, I think that we should not be afraid to say what we don't know. We should be able to say that information was incorrect and we have now a new view. We should go to the scientific community. We should go around sources and not always trust what we read and what our assumptions, because they can change at time. And remember that some of the concerns you may have are also concerns that the main audience can have. So we should have transparency at our information. And just to finish, here is a photo that we took from this presentation that was online. This is a group called InfoVacina, which was very important to training journalists that were already covering health issues during the pandemic on how to get the information about immunization correctly. How do we tell about immunization and vaccinations in the large media? And thank you so much.
Question? Oh.
Yeah. Oh, it's there. There.
Okay. Now we lost. We can't hear.
So my question is related to one thing, like in terms of media and what we have seen in India in last so many years, there is a term called breaking news. So actually this whole word of breaking news is actually flooding a lot of misinformation, because there is a huge competition among media houses. There are so many newspapers, as well as more than print media, it's the telemedia, television media, which is actually fueling lots of information flow. So in that situation, any negative news brings a breaking news. So that is something which we really struggle with, and especially the news of AEFI. Because for us, even for routine immunization, we have experienced this during polio eradication program and even during COVID. Any negative information, does not matter how smaller it is. I just quote one example where a news reporter visited one polio vaccination center, and there they found only one polio vaccine vial which was of expired date. It was kept separately, it was not being used,
Yes.
but then next day the headline of that local newspaper, it was not a national newspaper, was that children are being given expired polio vaccine. So you really don't have time, the readers really do not have times to go into the details where the correct details were provided. So even that way, that report was not wrong. So how our main challenge is not to train these bigger people. The idea of these with these Zoom meetings and others, they reach out to the big bureaus and bureau chief or editors and all that. But our major problem with our vernaculars and local newspapers, where we do not have reach and it's not possible to reach them. So sorry, it was a little longer. So just one thing, that how you have managed based on your experience, the local level newspaper, the district level newspapers and media.
We're just going to do one question so that we can move on with the presentations, and then we will have time for more interaction. I'm going to ask you, sir, that we wait a little, but we will answer your question, I promise.
Yeah, so this is the same everywhere. I think it's not just a question about India. We have also clickbait news in Brazil. And what I think is, when we look at that, we have to think, when does good news make the headlines? I mean, when is somebody going to click in a news piece that says, wow, it was a great immunization campaign, nearly 90 million children were vaccinated? Nobody's going to click that, but they're going to click one child death from a vaccine side effect. So what I think is that journalists must be ethical. They must think of how they are going to write. Even if it's something that is important to notice, such as one vial dose of polio vaccine that was expired. This could have implications on vaccine distribution or purchase, or how is the government spending their money, or if they are not making campaigns to use all those doses. This should be made also, this kinds of news piece, but you have to be responsible, because if you say kids are being vaccinated with expired vials and it's not true, then you are held accountable. But usually journalists don't think they are held accountable. So I think that ethical and responsibility are the answer.
And also,
S'il vous plaît, je voulais un peu compléter ce que disait Anna. Au fait, ces problèmes que vous avez évoqués par rapport à la concurrence médiatique, on l'a également remarqué à travers différents pays d'Afrique, également en République démocratique du Congo, d'où je viens. Le fait que chaque média voulait être le premier à publier une information sur le Covid-19 et sur la vaccination, ça faisait assez que beaucoup de médias tombaient dans les fausses informations parce que ces médias-là n'avaient pas le temps de trouver des bons experts pour leur donner des informations suffisantes. Également dans nos pays d'Afrique, les gouvernements également ne communiquaient pas suffisamment sur les questions de Covid-19 et tout ça a été à la base de la propagation de fausses informations. Voilà ce que je voulais ajouter.
mais aussi, and Jaya, now I'm going to start speaking for English.
Is it on? Yeah, it's on. Yeah, this is such a, it's actually a very good story. And if by any chance there were expired doses being given for any reason in any campaign, you want the media to be there doing that story. So there's a bit of a dilemma here. I think the major problem is we reach out to journalists, particularly in India, only when we want them there. And then between the campaigns, we ignore them. So we pull them in for World AIDS Day and for World Blood Donation Day, but in between they ignored. And I think, speaking to what Anna was saying, ethical, responsible, and informed journalism comes from constant contact with people like you who are in the field and with researchers who, so that the journalists become familiar with their work. But do we invite them? Do we appreciate them when they do a great piece? When we don't want publicity, do we still bring them on board, say, today I'm heading out into the mountains and I'm going to do this campaign. I just want you to be there and observe the way we deliver our work. So I think if there's that kind of relationship building between the times that we want publicity, at the time we want the publicity, they will be there, they will be careful, and they'll be sensitive because they know the wonderful work that you're doing. Yeah.
Very well said, Jaya.
Merci.
And I want to ask a question to you. How many of you have spoken to a journalist or have been involved in an interview just with your local reporter? No. Okay. How many of you do it on a regular basis? Okay. And why don't we hear a little bit about what a journalist could take from you when you speak to them? Patrick.
Merci beaucoup. Je m'appelle Patrick Kahondwa, je suis journaliste, je viens de la RDC. Alors, il nous a été demandé de parler de comment raconter votre expérience à un journaliste, et c'est là pourquoi. Alors, je dois d'abord commencer par dire que avec la pandémie de Covid-19, également avec la crise liée au climat, on a vu combien les informations scientifiques sont tellement importantes dans nos médias. Malheureusement, durant tout le temps de Covid, il n'y avait pas suffisamment de rapprochement entre journalistes scientifiques et scientifiques. Et cela a été, au fait, un problème, alors que normalement, pour aider la population à comprendre tout ce qui se passe autour d'elle, il faut qu'il y ait ces rapprochements entre le journaliste et les scientifiques. Malheureusement, comme je l'ai dit, il y a eu un climat de méfiance entre les scientifiques et les journalistes. Et pourquoi ce climat de méfiance est né entre journalistes et scientifiques? Parce que d'abord, d'une part, il y a les scientifiques qui ne sont pas habitués à parler aux journalistes. Il y a des scientifiques qui ont peur de parler aux journalistes. D'autre part, il y a également des scientifiques qui peuvent parler aux journalistes, mais qui ont peur de voir leurs propos dénaturés ou déformés par les journalistes. Et du coup, le scientifique se retient et se dit non, je ne parlais pas aux journalistes. Et ça, c'est un problème très sérieux. Alors, pour ces moments, le problème est là, mais l'idéal, c'est de voir comment rapprocher les journalistes des scientifiques. Parce que vous, scientifiques, vous êtes les créateurs des connaissances, et ces connaissances que vous créez doivent être connues du grand public. Parce que quand on fait une recherche, bien entendu, c'est pour qu'elle puisse servir à quelque chose au sein de la communauté. Alors, ce que je dois dire ici, les journalistes qui traitent des questions scientifiques, dans beaucoup de pays, ce sont des journalistes qui ne sont pas à la base formés à la science. Et ce n'est pas un problème. Parce que pour être journaliste scientifique, on peut être soit formé à la base à la science, comme Anna, ou être à la base formé comme journaliste comme moi et devenir par la suite journaliste scientifique. Mais c'est que d'abord, nous journalistes, nous devons savoir, c'est comment gagner la confiance d'un scientifique. Parce qu'un scientifique ne sera pas content quand il t'a donné une interview et puis à la fin, quand il produit ton reportage, tu déformes tout ce qu'il t'a dit. La prochaine fois, tu n'auras pas en fait l'occasion d'avoir ces scientifiques-là. Mais ce que vous devriez également savoir en tant que scientifique est que quand les journalistes vous approchent, ils ne sont pas vos ennemis. Les journalistes scientifiques, quand ils viennent auprès de vous, ce n'est pas pour vous piéger, mais c'est pour, bien sûr, chercher à avoir des informations qui vont aider la population. Parce que quand vous publiez une étude, ne soyez pas inquiets qu'un journaliste ou deux viennent vers vous pour savoir ce que vous avez publié. Et au-delà de ça, les journalistes scientifiques, dans leur façon de faire, on ne se limite pas uniquement aux seules publications d'un scientifique ou d'un groupe de scientifiques. Dans notre façon de faire, on cherche toujours à avoir d'autres scientifiques qui sont dans le même domaine que vous pour avoir leurs avis par rapport à la publication que vous avez faite. Et donc, c'est un peu notre façon de faire en tant que journaliste quand on approche les scientifiques. Également, quand on fait notre travail de journaliste scientifique et quand on vous approche, il arrive des fois où les scientifiques nous demandent nos articles avant qu'ils ne soient publiés, pour se rassurer que tout a été bien dit. C'est vrai, il y a certains journalistes qui refusent, mais il y en a d'autres, en fait, qui acceptent. Et moi, je suis de ceux-là qui encouragent, mais pas tellement, ça dépend des situations, les journalistes à permettre aux scientifiques de voir un peu ce qu'ils ont écrit. Ça nous permet en fait d'éviter des écueils et d'éviter également des contresens dans tout ce que nous voulons faire. Parce que comme je l'ai dit, quand on approche un scientifique, quand on parle à un scientifique, ce n'est pas une opposition d'idées, mais c'est une exploration en fait. On veut faire découvrir à la population quelque chose qui est connu du monde scientifique. Et donc, ce n'est pas un piège qu'on cherche à tendre aux scientifiques quand on vous approche pour parler de quelque chose qui touche la société. Alors, au-delà de ça, quand vous êtes scientifique et vous voulez parler aux journalistes, il y a des gens qui ont peur parce qu'ils ne savent pas, le journaliste va lui demander quoi. Alors, ce qui est bon, et ça nous arrive quand on fait des interviews avec d'autres scientifiques, qu'ils nous demandent d'abord les différentes questions pour nos interviews, afin que les scientifiques puissent avoir le temps de se préparer. Parce que la science, ce n'est pas comme de la politique où on peut trouver un politicien facilement dans la rue et il s'exprime sur une question donnée. Mais la science, au fait, demande de la préparation. Même si on est du domaine, je ne vais pas venir devant un épidémiologiste sans pouvoir lui donner le temps de se préparer et commencer à poser mes questions. Il ne veut pas me donner des informations qui sont profondes. Donc c'est important que vous puissiez savoir ça en tant que scientifique. Quand un journaliste vous contacte, prenez le soin de demander toutes les questions ou les grandes lignes de son interview afin de savoir comment s'y préparer. Et après ça, si vous le voulez bien, prenez soin aussi de jeter quelques regards sur ce qu'il a produit, sur ce qu'il a écrit, s'il le veut bien sûr, pour se rassurer exactement qu'il reflète en tout cas la réalité. Parce que comme je l'ai dit, la science, c'est différent. Et en général, un entretien, quand on le fait entre un journaliste et un scientifique, c'est pour une ouverture d'esprit et ce n'est pas une confrontation d'idées. Et donc, dans tout ça, c'est que nous, en tant que journalistes et scientifiques, nous pensons que vous, scientifiques, vous devriez rester ouverts aux journalistes. Parce que quand vous n'êtes pas ouverts aux journalistes, du coup, la population reste sous-informée. Vous êtes des producteurs de connaissances, je l'ai bien dit, et vos connaissances doivent servir la population à quelque chose. Nous sommes dans le contexte de la vaccination, et je vais parler aussi de la question des médias et la question de vaccination. Anna en avait déjà parlé, excusez, j'allais parler de Nadia. Anna en avait déjà parlé. Le contexte africain est différent du contexte d'autres pays où on sait facilement accéder aux experts pour expliquer quelque chose qui se passe dans la communauté. Mais dans nos pays d'Afrique, en ce qui concerne les histoires sur la vaccination, beaucoup plus sur la vaccination contre Covid et le Covid-19 en question, le problème c'était qu'on n'a pas suffisamment de scientifiques, on n'a pas suffisamment de laboratoires spécialisés dans nos pays d'Afrique. Et du coup, quand un journaliste africain voulait avoir une interview avec un scientifique, c'était vraiment très, très compliqué. Il fallait passer par d'autres canaux pour avoir soit des experts occidentaux afin d'informer la population. Et donc, en ce qui concerne les histoires sur la vaccination, et beaucoup plus sur la vaccination Covid, on est tous d'accord que la vaccination, c'est en fait une pratique qui a révolutionné le monde. Et les vaccins montrent aujourd'hui qu'il y a la possibilité d'éviter plusieurs maladies. Malheureusement, à travers le monde, il y a beaucoup de personnes qui n'ont pas accès au vaccin. Et parler d'accès au vaccin, moi je vais insister beaucoup plus sur la confiance au vaccin. Parce que la confiance envers les vaccins naît aussi en fonction de la communication qui est faite sur ces vaccins-là. Et cette communication sur les vaccins, elle est faite aussi par les journalistes. Et les journalistes ne peuvent communiquer sur les vaccins que quand il a accès aux scientifiques que vous êtes pour bien expliquer à la population les fonctionnements des vaccins afin que cette population puisse avoir une confiance dans la vaccination. Et au fait, la réticence vis-à-vis du vaccin a été alimentée par les informations qui circulaient sur les réseaux sociaux parce que, comme je l'ai dit, beaucoup de gens n'avaient pas accès en temps réel aux informations sur la vaccination. Dans mon pays, le tout premier vaccin contre Covid qui a été introduit dans mon pays, c'était le vaccin AstraZeneca. Et il y a eu beaucoup de problèmes autour de ces vaccins-là, et c'était parce que les gens n'avaient pas suffisamment d'informations sur la vaccination. Et quand il y a eu d'autres vaccins qui sont venus, du coup, les gens étaient perdus et ne savaient pas quel vaccin prendre et quel vaccin laisser. Et donc, c'était tout un problème. Et voilà pourquoi il est important que les bons messages puissent circuler, que les bons messages viennent de vous, scientifiques, pour que nous, les journalistes, nous les fassions circuler auprès de nos populations. Et donc, je l'ai dit, pour vraiment y arriver, nous, journalistes scientifiques que nous sommes, et vous, scientifiques, on a cette obligation d'informer la population sur les fonctionnements des vaccins. Et quand un scientifique également s'adresse à la population ou il parle à un journaliste, il faut le faire dans un langage simple. Parce que ce n'est pas à un scientifique que vous parlez, mais vous parlez à une personne qui n'a pas de connaissances sur la science. Et cette personne a besoin de comprendre aussi ce qui se passe dans le monde scientifique. Au-delà de parler dans un langage compréhensible, il faut également utiliser une langue que la personne va bien comprendre. Je viens d'un pays où nous avons 4 langues nationales et une langue officielle avec plusieurs dialectes à travers le pays. Mais tous les scientifiques communiquent en français, la plupart des fois. Et dans des pays anglophones, la plupart des scientifiques communiquent en anglais. Alors qu'on s'adresse beaucoup plus à des personnes qui ne sont pas suffisamment instruites, mais qui ont besoin d'informations. Donc, à votre niveau aussi en tant que scientifique, vous devez relever ces défis-là et apprendre à communiquer dans les langues locales de vos pays respectifs pour permettre au fait, aux populations de mieux comprendre ce qui se passe dans le monde scientifique. Alors, pour conclure, au fait, Les journalistes et scientifiques et les scientifiques, comme je l'ai dit, ils doivent interagir. Il est possible de travailler ensemble quand on est journaliste et quand on est scientifique. Parce qu'on a tendance à croire souvent qu'un journaliste et scientifique est un scientifique. Je l'ai dit non. Bien que certains journalistes, comme je l'ai dit, sont formés à la science à la base, mais ils ne sont pas des scientifiques. Il est journaliste et son rôle est de mettre à la disposition du public les connaissances scientifiques, aussi en utilisant un langage simple. C'est notre principe à nous, journalistes, quand on s'adresse à la population. Et donc, en dépit de la diversité qui caractérise les scientifiques, les parcours qui caractérisent les journalistes et scientifiques et les scientifiques, des situations et des personnalités qui sont parfois différentes, entre nous journalistes et vous scientifiques, on partage une même passion. Et cette passion qu'on partage, c'est une passion pour la science. Et cette passion pour la science, on doit vraiment la partager de la bonne façon pour aider nos populations à avoir de la bonne information et beaucoup plus de la bonne information sur les questions de la vaccination, parce que c'est de ça qu'on parle ici. Thank you very much.
Bravo, Patrick. Very powerful message. And it is a question of trust, right? And it is a question of message, because what we communicate could harm or could build trust. And so to talk about messaging, my colleague Jaya is going to share some very important information with you.
Yeah, thanks. May I have my slides, please? Yeah. Sorry.
Take this.
To move the slides. Okay. I wanted to add one more point to what the good doctor raised earlier. I think you brought up something really important about the local language media in India and particularly in other countries as well. I often feel that English language journalists and the mainstream, the big bureaus and the stars, they get all the attention and the investment, and no doubt their impact is powerful. But in countries like mine, I think that local language journalists reporting in Hindi, in Tamil, in Malayalam, in Kannada, I mean, these are the journalists who really have a visceral connect with their communities, particularly in the tier 2, 3 towns and in the villages. And very often decisions about health are as much based on information as they are on emotion. So I think that cultural opportunity is what we're failing to leverage by not investing in local language media. And I'm very happy to say that at this point, the Sabin Vaccine Institute is supporting Internews to translate an online e-course for journalists called Let's Talk Vaccines into Hindi. So that's going to be made available soon, and we have a number of journalists logged onto the course. So I think unless you train journalists and equip them with the language, words are our bread and butter. Unless you give us a language with which to report your concepts that you took years to understand in medical school, and you can't expect the journalist to get it off of a single press conference. Give us the tools, give us our words, and then we'll try our best. That's my appeal. Please invest in local language media in your country. I wrote for Frontline, which is a very high-end English magazine in India, and I also wrote for a glamorous cinema news and political news weekly in Tamil in my state. And I can share the experience that in all my years of reporting at Frontline, I may have gotten about like 2 or 3 letters of appreciation, very elegant letters. But when I wrote in this political news weekly about AIDS, which used to reach sex workers and truckers and so on, I used to get about 50 letters a week full of questions, you know, and then it became a year-long column. So you get that sort of connect, and it's a tremendous opportunity that I think we failed to make use of. And I'm sure Anna and Patrick will have your own experiences to share. So I know we have very little time, so I'll quickly go to something on the slide here, which is, okay, I come from Internews. We work in about 100 countries, and we work closely with local media and hyper-local media. We pay a lot of attention to local language journalists because we find that they are our greatest allies in times of emergency. So they're always there. But then we have to be there a lot of the times when they are going through difficulties and show that we're a solid source of support for them. That's how that relationship is built. So if a journalist with a 6 o'clock deadline calls you at 5:30 when you're in your clinic and says, can you just clarify this? What is the difference between efficacy and effectiveness? Just put your patient on hold and give him that explanation. He will remember it and you'll get accurate reportage in the paper. So it means making time for journalists and letting them know when you can contact them. That's how you become a trusted source of information for journalists. On that note, I'll add that you'll find some doctors figuring in the news all the time and others are never there. The ones who get reported, who are there, who feature on the channels, are the ones who are communicative, who are there and available for journalists. Journalists have their WhatsApp numbers, with them, and there's already that relationship that's built up. Okay, so I'm just going to quickly go through this one more thing, which is this is a learned audience, so I'm not going to dwell on this slide. But many people think that the journalists can be bribed and you can buy space in the paper or you can swing the angle that you want. So I just wanted to draw your attention to something here. Journalists' commitment is to objectivity and truth-telling and verification. Sounds very grand. It's an aspirational goal. We are always chasing that goal. We control nothing. You control nothing that goes into the news media. So it's up to, if you want to control the narrative that you want to portray, better be prepared. And you'll hear more about that from Nadia. If you want to engage well with journalists, then you have to become a consumer of news media content. How many of you read an online news feed today about health? I don't think many people would have. You're here at this conference. But at home, I make it a point to read The Hindu, The Express, online, at least 4 or 5 media, so that I can follow what the health news is of the day. And most importantly, that's how you learn to become a contributor to the news media yourself. Here, when we read those news items, pay attention to the bylines. A byline is nothing but the name of the journalist in that article, and you'll find names like Anna Bottallo's frequently cropping up, or Patrick's cropping up in every article. So okay, she's the one who's there on the forefront of covering the epidemic. She's the person I need to reach if I need to get something important out into the press. So by a show of hands, can anyone, do you have the names of at least 3 journalists in your district or in your town that you can recall are people that regularly report on health? I know Julia's hand's going to go up. Maybe Gopi's hand's going to go up, but no? Okay. Yeah, I mean, that's something that you can set right the moment you get back home. Just start consuming news media and the health reports that come into it. You can subscribe to some of these, and you'll very quickly be able to figure out who are the Annas, who are the Patricks, who are the Jayas, who are the Ramya Kannans, who are the people that are regularly on the health beat. Those are the people to go to when you have a more complicated issue to cover. Don't reach out to your average news reporter. Start reading the news, first tip. And so then what is news? Anyone? What is news? Can anyone define it? Julia, want to take a shot? It's nothing new. News is nothing new. I think my colleagues will disagree.
I heard that it's north, east, west, it's south.
North, east, west, and south? Okay. How I wish it was that was like a metaphor for comprehensive reporting, but no, we don't have time for comprehensive reporting on the news beat. Okay, so many scholars have said that the news is whatever we say it is. It's what the editor says it is. It's what the chief reporter says it. It's maybe the politician who owns our media. It's what he says it is, whether it's Bolsonaro or Nelson Mandela. But there are some 3 broad things that generally determine what gets into the news, and the first one is novelty, right? A new research paper, maybe like a single-dose HPV vaccine instead of a double dose, maybe a newly launched DOTS program, and so on. It's all of these. A new COVID vaccine, it's all new. So the novelty aspect is really key. And the second thing is timeliness. Yesterday's news is no longer news, right? So it's important for your press clipping book to understand the history of how news reporting is evolving. However, it's got to be timely. If you're going to release a news report, a piece of research, or launching a campaign, or a surge vaccination drive somewhere, make sure you have the media informed about it at least a week in advance and prep them, right? So timeliness, you want the news to appear the next day. The third thing is proximity. So people in Guatemala are hardly going to be looking at what happens in Sydney, and people in Brazil are not going to be interested in what Prime Minister Modi is going to be saying about COVID vaccines in India, although we have a very excellent comparable immunization program, a solid thing, which I think saved both countries. So these three basic elements, there are lots of other things, but if you keep in mind these three elements when you're writing your press releases or when you're pitching a story to a journalist, is what I'm saying somewhat novel and interesting? Is it timely? Is it like the topic of the moment? And is it proximal? Is it something that this neighborhood newspaper will cover, the city edition will be interested in, and so on? These are three broad aspects. So here are some examples of timely, a novel and other news releases that satisfy the proximity angle. So these are all headlines that you're very, very familiar with, right? And there you go. This is the kind of thing that you see in the papers. And this is something that I think all of you will know. This is classic CDC advocacy stuff. Three questions that all of us as public health workers need to answer for our audiences are, the audience will want to know, when I go into a community with a vaccine, well, why should I care about it, right? What impact will it have on me, my family, my loved ones, and then what do you expect me to do about it? What do you expect me to do about it? Like, clearly you want them to do something. You want them to like roll up their sleeves and take the jab, but we have to make it clear. So these are the three questions, and you'll be surprised to discover that journalists often have these three questions in mind when we create our stories. We want to know, why is this going to be important for our audiences? What kind of an impact can I have? I mean, that's something that keeps me awake at night. So I want to make a splash. I want to get the Pulitzer. I want to really make a name. And then what do we expect our communities to do about it? So whether it's election reporting particularly, I mean, all of these things concern a journalist as much as it concerns you. So I love this from, this is a couple of lines I picked up from the Toronto Star just this morning, done by a journalist, I believe, called Catherine Little. And I just want to draw your attention to the second quote there. Science doesn't make a decision, people do. So I just want to draw that distinction between, the people sitting there and the people sitting here. Your basic unit of communications are facts, right? Data, efficacy data. Confidence level intervals, vaccination coverage rates. But our unit of communication here is the message. And it's quite different, and I'll show you how. So if you look at data, it's, 2,000 cases of measles in Zimbabwe in 2022. That's real, honest-to-goodness data. They had about 157 deaths. And when you take that data and put it in context, then you see that it's 7 times the number from the previous year. So you're adding another layer of evidence and putting that 2,000 number in context, right? And the children mainly missed their vaccines because of pandemic-related lockdowns. So that piece of data has been put into context. Additional evidence has been added to it, so we understand what that 2,000 number means. Otherwise, it means nothing to either you, me, or the journalist, right? But then when this turns into a message, let's say you're on a radio show and you're talking to parents in Zimbabwe, then you're going to be sending out this very powerful message that ensure that your infant is vaccinated for measles, before the first birthday. That's really the primary message. You want to save lives. But let's say you're going to be spinning an op-ed for the local newspaper, right? You can target it at policymakers and say, please invest to restore access to MMR on an emergency footing. Or for every dollar you spend on vaccines, you can save about 20 or more. I don't know the exact figure, that's imaginary, on vaccines. So this is something that will appeal to a planner, someone in the ministry, right? It's the same data, the same information, but you can spin it depending on who you are giving that interview to and who is your anticipated audience. So obviously this requires some thought. All of this won't shoot into your head when you're sitting in front of a mic and Patrick is asking you these questions and Anna's giving you the look. So this has to come beforehand. And what you're seeing on this last slide is nothing but a fun word that is really easy to remember. It's your SOCO. So that thing that you want to sock into the minds of the audience, it's your single overriding communication objective. Again, classic WHO training. So your SOCO, the word comes from an old Navy training term, and this is essentially that single-pointed thing that you want to get across to the audience without diluting your message, right? So any questions on this slide? You got the difference between data, information, and message, right? It's pretty clear. So the other important thing about the SOCO is that it can help you frame your message. We heard about framing messages this morning at the misinformation session. So if you're talking about gun control, you can frame it as an issue about individual rights. Obviously, this is the pro-gun lobby. But if you were someone who was against guns, you can say that it's about public health, right? You can't put guns into the hands of everybody because you can frame it that way. Should the government have the ability to control an individual's ownership of guns? Yes, because it's about protecting and defending innocent individuals and communities and making it safer. So you can frame the same way, individual versus public rights, and that's what your SOCO can really help you do, right? Right? So the other thing is, you can't just take a SOCO, you can, but you can't just take it and walk into a TV studio or be interviewed when you're having your vaccine campaign on the streets of a busy village, and then Patrick's going to come and stick a mic into your face and asks you, why are you out here today? So, right? And then you need to have your SOCO, your primary message, clear in your mind, but to make it attractive and make Patrick put it into the headline, you want to convert it into a soundbite, right? So what's a soundbite? Here you see an example of a SOCO. Murder stories dominate the front page of the newspaper. That's your SOCO. And you're essentially complaining about it, but here's how someone turned it into a soundbite. If it bleeds, it leads. That's your lead article in the newspaper, right? This is so catchy, and that's what goes into the headlines. So it's worth sitting with your comms officer, sit with Nadia, or the equivalent of Nadia in your organization, and try to turn that SOCO into a very, very catchy soundbite that is likely to make it to the front pages of the newspaper. So here is what we do. The blue triangle that you see is your classic IMRAD, right? You have your introduction section in your research article that you're putting into the Lancet, BMJ, wherever. You have your materials and methods, you have your results and your discussion. That's your classic IMRAD approach. As scientists, we're trained to sort of write our stuff that way, very carefully, right? We layer arguments one on top of the other. But if you ask any of us sitting here as journalists, we do the exact opposite. We'll flip that triangle upside down, and we'll put your most important discussion, your interpretation result, right up there on front, right? What is it that you're going to try to recommend to people? Is there in your interpretation section? That's what will lead in a newspaper. So that's up there, that's your SOCO. And we will add supporting evidence, such as this finding came out of the results of a study done by Gopi from UNICEF in Jakarta, which looked at indigenous communities and blah, 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 right? And then we'll add on case studies, probably related by you. We're saying that some tribal chieftains I found are the most influential people in that community, so we worked with them, and this is how we improved vaccination coverage, right, Gopi? So there you go, you have case studies, and then I'm going to come back and saying this is why maybe your SOCO is it's important to work with social influencers if we want to drive up vaccination coverage rates. That's the second one. And you add more evidence, saying Jakarta is a place where vaccination has suffered a lot during the COVID-19 pandemic, and now we're trying to restore access, and these are the rates of decline, blah, blah, blah. The ministry is investing so much, and that's why we are working with community influencers. So you're repeating the SOCO 3 times. I remember doing this with Peter Piot when he was director of UNAIDS. So he had the SOCO, asking for more investments into UNAIDS at that time in 2000, 2001. So every time he had to say his SOCO, right, he would step up to the mic, lower his voice, like special voice, and say, we need more money. right? I would step back, continue with the story, and then give the evidence and so on, so on. Africa, so many people done it. Ladies and gentlemen, we need money. You know, so you repeat it. Audiences remember what they hear first and what they hear last. So repeat your SOCO 2-3 times, but don't leave us with a message. We are not your messengers. We are thinking people with critical skills. Our editor will want to know what's the evidence to push that message that someone is pushing on you. So be sensitive, help us develop our critical thinking capacity, give us the evidence, explain what it means, support us with case studies, take us to the field, give us those sound bites and interviews from your communities, and then you have a story that you and I can be proud of. So here's another example, just to, okay, so I thought this could, anyone wants to take a shot at developing a SOCO and a soundbite? Do we have time? If everyone's like post-lunch torpor, then it's okay, otherwise. Okay, but I'm going to leave this exercise. I can always like WhatsApp it to the group or, you know, share it out on email. You can try it. Believe me, unless you try doing it in your office, it's not going to come when you're out there on the street. Sure. Yeah, depending on who your target audience is. Yeah, sure. So it could be as simple as Peter saying that we need more money. Yeah, the investments are a top priority. And you could repeat that 2-3 times, but you could say that in a fun way, no money, no results. Very short, very short. Exactly. Yeah. Absolutely, absolutely. So it's investment into the health systems that can save lives and reassure, yeah. So that's an exercise that you're going to take back and try. Those of you who've taken a photograph, but then remember that your SOCO could become a headline, right? There's some examples. Vaccination is a must for young and healthy, says doctor. This was in 2021. You know, when they thought that only COVID-19 vaccines, you know, according to the government prioritization, you know, it had to go only to the older people with comorbidities and so on. It's like when we journalists were covering HIV back in the day, all we saw on the government slides and on NGO slides were how many infections among sex workers, injection drug users, and among men who had sex with men. And so we identified the epidemic only with those groups, and we stigmatized them, right? And so that's because that's all the data we got. No one put that data into context for us to say that anyone is vulnerable. We just don't have the data from the family welfare clinics that showed that women from quote-unquote good families were getting it. Anyway, so I'm going really fast here. But remember, when you're talking about issues and barriers and challenges that you're facing, you want to put either a negative spin on it or a positive spin on it, and you can leave it to us to give it the negative spin. So that same issue about lack of cold chain and transport facilities are the only barrier to achieve vaccine coverage targets, say experts, that's you, could very well be turned by me into cold chain and transport woes hamper vaccination drive in DRC, which makes you look bad. So you have to be careful that you have that relationship with the journalist, and the words you use have to be absolutely key to how you want to spin it. So remember, you can focus your SOCO on what works new. If you don't have anything new, maybe you have an example of what works best, something different. And I can think of a great example from Anuradha on day 1, where nomadic communities in Chad, if you were listening to that plenary, you know, combining immunization for their livestock with immunization for the children. What a great story. I'd love to have been there, surrounded by the camels and the horses and the sheep, watching the children and the animals getting vaccinated together. What a great piece of outreach. So that's the kind of story we love. So what has changed in our approach? How are we learning and innovating? All of that can be the news. So do I have a minute more? Yeah, so here, you want to go back. Right? Because we don't have new stuff to give the media every day. Research takes months and years and may fail. And most of us never publish the negative outcomes of our research. It goes into the wastebasket where it doesn't belong. We want to create a separate journal for all the experiments that have failed, but we want to know, put a different novel spin on new things by presenting it differently, right? So that could get it into the news, and I'm almost done. So here's your how to bake your cake, how to bake your little news pitch to the media. There's step 1, step 2. There's eggs and sugar, butter and cream. So write down the data you want to share with us. Add context, clothe it with context, additional evidence so that we can make sense of what that data means to you and why you feel it's important, so that we can fill in that evidence in our story and it'll help us think like you and understand your rationale. Choose your target audience carefully and spin your SOCO accordingly, right? And then make the SOCO talk, make it into a soundbite. So what's the average length of a soundbite, anyone? So when you hear a soundbite a soundbite is just a very short quotable statement on TV. Less. We will take the mic and go to the next person. Maybe about 8 seconds. 17 characters. Yeah, 17 characters. There you go. Hear it from the experts. 17. 17. Write it shorter because you'll have to deliver it with feeling. Huh? It's a performance, remember? Yeah. So if you're out there in the community and you're protesting for more money or for, sex education in schools or something, and we come and stick a mic into your face and ask you, why are you out here today? If you're fumbling, and then we've already moved on to the next person. So because we have to get back to the studio, do the edits, and add on the stuff, and then, so be ready. Just wait for us to come and grab the mic from us. So there you are. Gather additional data and case studies to support the SOCO and provide them to journalists. So always feed us more information to help us understand why your SOCO was important. If you have photographs, video clips, photo voice stories, take us to the field. All of that can build this news story into a feature story. So I think I'll leave you there. I wish we had more time for an exercise, but yeah, thanks for your attention.
Okay, great. Next. Hi. Hi. What happened? The next?
No, that is the contact details. Last slide.
Oh, yeah. Oh, my contact details, I didn't put them up.
Oh, we can give it to you. Yeah. Okay. Next. Okay. 4? No, presentation 4. Thank you. These are just the conclusions, and these are just some recommendations that we hope you find very useful. Next, because I can do my next. Ask questions, understand what media needs. This is, just to sum up what we were trying to tell you today, we want you to remember what makes a good story, and we want you to really prepare. You are the experts on your subject, but you still need to prepare to make sure that you say everything that you need to say, and to make sure that what you say makes sense. And practice in front of the mirror, talk to your kids, just do anything you can to be prepared. Understand your role in an interview. Oh, and before that, of course, fear no question, because you're prepared, so prepare. And practice and share learnings. And think of the media as your allies. We've listened over and over again when talking about misinformation and disinformation that social media has a tremendous impact in what people trust and not trust, and the kinds of decisions they can make about their health. Informed media, scientific media, science journalists, health journalists are your allies, so talk to them. It's your greatest opportunity to get the right information out there, support them. It will help build credibility and trust if you share with them the right information. It will help you reach influentials. Most of you are generating knowledge and research that help inform policy. So make sure that information gets to them. And that's important because then you need to think of a purpose. It's not just about talking to the press or talking to anything or even social media. You need to have a purpose. Just think about that. And of course, building support for vaccines because we're here talking about immunization, but helping people make better decisions about their lives. That's the most important. That's what we really want to achieve. And something my colleagues just spoke about, they're on a deadline. They need to write their stories fast, so they don't have time to wait for you for 2 weeks because it's not gonna get published. So if somebody calls you and they need the story, ask them questions. Ask them when do they need to publish their story, because chances are, if you help them, that will help you get your message across. And think that there's multiple platforms. Hey, your message can go to social media and it becomes viral, and that's good, that's something good. And that's why there's nothing called local anymore with Twitter or I mean, it just gets everywhere. And something that is happening in India, even though it's not necessarily relevant in Brazil, becomes something relevant in DRC because it has to do with the Serum Institute, and there's something that's being shared that is relevant there. So nothing is local anymore if it becomes relevant. And how do you make it relevant? You need to tell a story. You need to connect with people. Data is cold. Data is important, but it needs to be translated, like Anna was saying, right? You need to translate it into terms that are meaningful to people. And they need to be timely, as Jaya was telling us. It needs to be universal. It needs to connect. If vaccines are about saving lives, remind people that they're going to protect their lives and their livelihoods. Have strong visuals, and visuals are not necessarily photos, although photos, especially if they come from communities, are very useful. So remember, when you go to the communities and you're talking to everybody that you work with, take a camera or use your phone. Get some pictures about what, and share them with your communications staff. Take some video with your phones, and it's going to be very helpful. And of course, that shows that evidence is a trend. And of course, we want vaccines to become trendy because it's good. It's something good. So great to train. This is something that I find extremely important because you need to think. You need to have motivation when you speak. Otherwise, it doesn't make any sense. Better be quiet or tell a journalist to talk to somebody else. Why are you talking to a reporter? What do you want to achieve? Why does this reporter want to talk to you? Find out, ask questions. When we communicate and exchange information, we have a better chance of helping each other. So always prepare, create your SOCO, use your evidence, have your messages. Be honest. Honest is the best key to be remembered, because it's going to be truthful and it's going to generate trust. If you're a little wishy-washy journalist or you have doubts, not just journalists, we all know, and we hate those kinds of people that are just like trying to tell you whatever. That's the problem sometimes with bad politicians. I mean, they're just trying to tell you what you want to hear, but that doesn't necessarily mean that they're connecting. So be honest, be open, listen. What is this journalist trying to write about? Why do they need? Be respectful. Maybe somebody is not as informed as you, but you can change that. So be agents of change. And stay positive. There's a lot of negative things, but how are you informing policies? How are you generating change? All of you, I mean, it's just incredible. I've been talking to many of you. You're change makers. You are making a difference in your communities, and you're helping people protect their lives with vaccines. Brag about it, but tell us the story. And you control the message if it's meaningful, and you prepare, and you have your SOCO. So these are just do's and don'ts. Don't use jargon. Don't use medical terms that nobody's going to understand. If you do, explain them, because chances are My mother, who went to university but was not a scientist, is not going to understand. And we want her to understand because, well, my mother believes in vaccines, but at the beginning of COVID, she had no idea and she didn't know. And she asked me, what do I do? There's so much going on and I'm getting these messages from WhatsApp. So explain it to them and explain it in terms that are accessible. Very important, we were talking about this earlier. Simplify is not the same as accessible. You don't need to simplify. You just need to make sure that a 15-year-old can understand your message. And if you're involved in generating trust from youth or children on HPV or any other vaccine, think about this. Think about who is listening and who you want to reach. Don't repeat a negative. If you get a negative question, because Jaya was saying, sometimes the negative information is what sells. If it bleeds, what was it? If it bleeds, it leads. So don't ramble. Just think of and that's why you need to prepare, because then you will get straight to the point, which is really important, because if you go around the clouds, anybody gets lost. You start a conversation and then by the end of I don't know, 5 minutes, you don't know what we're talking about. And don't assume that everybody knows or that everybody should know what you think they should know. We don't know. If we're supposed to know, we might not. So keep that in mind. And tell stories, because this is what's really going to help you connect with the human side of, we're all human. So if it's something that is going to help you remember, if it's my mother that didn't understand vaccines, maybe that's what you're going to remember of all of this. What are your thoughts?
Well, before anyone jumps up to the mic to say something, I'd just like to add on what you were saying. Sometimes I've heard that a lot because a lot of scientists, they like Patrick told, they don't trust the media because the media turns into headlines and makes confusion, doesn't get the message. And sometimes I talk to scientists that say, I don't speak to that or the other media outlet. And I think this is very wrong because first, media outlets different from journalists. Journalists are people, they are critical thinking, they are not controlled, we are not always, we don't usually have a story read and just want you to write your name down. That's not true when we are communicating in science and health. Second, if you think that that media is bad, that's why you should talk to it, because it makes it better. And third, sometimes I hear that, but you twist what we say, you always try to sell, or you only think of ways of putting it like clickbait. Well, clickbaiting is bad. Any news media that's professional won't do clickbaiting. So if you trust that media, you should trust the journalists, and you should trust that they won't do this sort of thing. Clickbaiting is when you put a phrase that's very clicky so that people would just open the news piece, and that in that way you get audience. It's not the same as breaking news. Breaking news is breaking news. So new polio case in Pakistan raises concern, that's breaking news. Clickbaiting would be, look what's happened in Pakistan, we had a new polio, ... That's clickbaiting.
Think of showbiz news.
Yeah, exactly.
Ouais.
Exactly, that's clickbaiting.
Look here, the real reason.
Mm-hmm. That's totally clickbaiting. Yeah.
But there could be positive clicking if you have a good SOCO.
Well,
Then you just make it attractive.
Autre chose,
Yeah, the problem is that we as media outlets also work with Google and audience, and we have to also choose words that are trending. That's the problem. So sometimes we have to use some words in the headline because we know they are going to attract information.
Voilà, je voulais également compléter par rapport à ce que disait Anna. En fait, la confiance, c'est la clé pour réussir cette collaboration entre journalistes et scientifiques. Également, Jaya l'a dit, que ce qui intéresse les journalistes, c'est ce qui est d'abord nouveau, ce qui est proche également de l'audience à laquelle on s'adresse également, que ça soit bien sûr limité dans les temps. Mais au-delà de tout ça, si confiance, on veut que la confiance existe réellement, il y a des journalistes qui sont prêts à accompagner les scientifiques dans leurs travaux. Donc, dès le début de votre recherche, vous faites vos analyses au laboratoire, vous pouvez vous faire accompagner par un journaliste et il va mieux comprendre ce que vous êtes en train de faire, et quand le moment arrivera de faire un article scientifique à publier dans un média, il aura beaucoup plus de mots faciles pour faire comprendre à la population ce qui a été publié par le scientifique, et ça serait beaucoup plus mieux.
Thank you so much for all that you've said to us. This is fantastic advice. I'm sure the audience will agree. And I ended up doing, in the first 2 years of COVID in Australia, 409 media interviews. Television, radio, print, opinion pieces, you name it. Because as a researcher in vaccination and, 25 years in vaccination, so I knew a bit about vaccines as well as vaccination-related behaviours, I wanted to see that research reach the public in a time of crisis when they needed it. So this is like an encouragement to the people here. Most people haven't done a lot of media here, judging by the show of hands. I'm sure you've all had a little bit of experience with the media, but let me encourage you to engage with journalists. Health, and as you've said, health and medical reporters, science reporters, they have a bit to lose if they betray your trust. So we're often trained to not background journalists, and you may have limitations on your role depending on what organisation you work for. It's much easier for academics to be independent in their commentary. But if you can just give journalists a bit of background, so for example, even warning them, look, you're going to hear this kind of script on this story. A lot of people will focus on public attitudes to vaccines and they will miss the story about distribution of vaccines. So you're priming the journalist for the day that they're reporting that particular story, so they listen out for the issue around access systems, which is a much harder story to tell. And I'd also I'm sorry, this is all comment, not questions. Well, I do have a question. Just one more quick comment though. We need more women speaking in the media about vaccination, and that's why I got up first, because I thought, damn it, women don't get up as much. So, but if you're a female, you will probably tend more to want to stay in your lane and think, I'm not qualified to speak about this. You need to stay in your lane. You need to have expertise in what you're talking about, but don't be overly cautious about that as well. So for women in particular, let me encourage you to be out there speaking about the topic that you have expertise in, because your audience, girls, other women, the population need to have that diversity. I mean, there are other diversity issues we had in Australia as well. But my question is this: as journalists, you would have experienced harassment and bullying, particularly if you're reporting on issues like vaccination. And we know that people like me get threats, harassment, bullying just for simply promoting vaccination in the media. How do you advise that we manage that? Because I think it can put some people off, particularly women and people from diverse populations. Thank you.
Yeah, well, because of the current status in Brazil during the pandemic with President Bolsonaro, all the journalists were harassed, all of them, independently if they were covering health or science, because he was very against all media. So he would come out every day and talk bad about media, and that would stick to the population. So every journalist that worked in professional media outlets was attacked in some way. I got some messages to my Twitter, sometimes even in the newspaper, but what I do is that I close all my accounts. And that is something that we are advised at Folha. We should not respond, we should not let them get to us. If there's any sign of threat, we have all the juridical support. But of course, that affects your mental health. So what sometimes I would try to do is, first, I'm doing my job on reporting on vaccines. If there's this kind of crazy people that follow Bolsonaro that are going to attack me, I should be able to stand aside from it and not let this affect me, because I know they are only working as, we call them cattle. It's this sort of behavior, group behavior that where everybody follows the message, the leader, but they don't even know what they are against. And the second is, I think that we have to, as you said, Julie, be able to create groups that are more supportive, even within journalists. So we don't need to be battling against each other. We don't need to have, envy or feelings that, oh, that journalist gave the news first, or I'm going to try to do this in another way that I'll get the breaking news first. Because in that way, we create this environment that contributes to what they are going to do to us, which is attack. And I think that, just to sum up, as you mentioned with the diversity, I always try with my news piece to balance gender. And that's something that I personally like to do. Of course, there's not always the chance, but I encourage everyone, when we can, if you're working in an institution and you have something to tell, you have a new story, you have a new research, encourage the woman in that research to be the front speaker. Encourage that there is diversity in the person that is going to go to the media and going to give the interviews, because that's what makes us stronger, I think, and builds a shield that we can use against these kinds of attacks.
Ouais, je voulais compléter, Anna, par rapport à la question d'impliquer beaucoup plus les femmes dans ce que nous faisons. Je ne sais pas si le contexte est le même partout, mais les femmes scientifiques, elles ne sont pas encore suffisamment nombreuses dans beaucoup de pays, et encore beaucoup plus en Afrique. Et celles qui sont là, l'éducation aux médias pour les femmes, c'est encore quelque chose de très nouveau. Elles peuvent avoir de la matière à dire, mais parler devient beaucoup plus difficile. Donc, il serait également question de travailler sur les femmes scientifiques et leur apprendre à parler. Parce que, comme tu l'as dit, quand c'est la femme qui parle de la question de la vaccination, elle a plus de chances d'être écoutée par d'autres femmes. Et donc, c'est très important que les femmes scientifiques également travaillent sur cette question, qu'elles s'entraînent aussi à parler aux médias, et c'est quelque chose qui pourra aider tant soit peu à changer quelque chose au sein de la communauté.
Et aussi des autres chercheurs, non? Also, you're sharing your voice and encouraging other researchers and other scientific voices or voices from the community that are women. Any other questions? We have a few minutes. Well, we started late, so.
Let me first, I must comment before I ask you this question. It's very simple. Having worked with media for more than 10 years or more, firstly, I have a strong feeling that media is poorly trained in public health, number one. at least in my country, in India, they're very poorly trained, and they don't want to admit that. They run their own articles whenever they please, and whenever something comes they want to sell. For example, during COVID, I was on national television. If I wanted, I could do it every hour, every day. Okay, I could be there. But I chose not to because, it's nothing else you can do otherwise, okay? And those are pro bono services saying how COVID is impacting the children and all as a medical doctor. But then when I built those rappos, I did a lot. But I thought I was building a rapport and relationship. The COVID is over. And if I want to now reach out for poor, marginalized children, vaccinations and access to vaccinations for the most poor in areas where I'm currently working, they are not responsive. But whenever they need their bites, those 24 hours, they are still there. See, the mean and selfish people.
No, I don't think so. You have to understand that when COVID started, everybody needed every media organization needed a reporter to cover on it. And not everybody was well trained, and not everybody knew the least thing or remembered anything about what they heard in school about biology. I've been working with media for more than 20 years, and I think the key is to build good relationships. And it's something that Jaya was talking about before. Maybe you haven't, and think of this too. If you build a relationship and you feed them information that you think is going to be relevant and is timely, I assure you, they are going to call you. It's just the way it works.
Well, they do, but only when
No, but wait. We're still responding.
She would know in the Indian situation
Yeah,
better.
yeah, of
She
course.
would know. She would know.
No, I can say one thing. When I was working in Frontline, N. Ram was he was the editor-in-chief of The Hindu. And he used to go around saying, for those of us who used to report on, all the development issues, he said, remember, I don't want an advocate in my office. No advocacy here. So we journalists don't do advocacy. It's not our job. So what preoccupies you day and night, driving up vaccination coverage rates, it doesn't keep us awake at night. We are committed to truth-telling. We are committed to a pursuit of whatever is happening in the field at that point in time. And health is just one of the many things we cover, and we're not specialists. So we have to get past all that. During COVID-19, everybody became a health journalist because that was the news globally. The entire world was wrapped up in that moment where it was like people dying on the streets in Lucknow and elsewhere. So there was no other the rest of the stuff that was going on got literally wiped off the pages of the newspapers. So I just wanted to say that there are different imperatives for each profession, and ours is not public health. So that's the first thing. Second thing is we don't do advocacy. So I think at what point do these two reconcile? It's only when you present your news to us in a way that makes sense to us to report. That's when we're there for you. But in between, you have to keep exposing us and helping us understand all the things that you've understood so that we use the right language and the right terminology. This is if you want the media coverage. My second suggestion is, with mobile phones and with online media at your disposal, have you thought of blogs and photo voice journalism, citizen journalism? There's a tremendous opportunity for researchers and clinicians who are good at communicating. Take the help of someone and produce your own copy in the media. If you're disgusted with a journalist, stay away from them for a while and try producing your own copy. That's another alternative. But I would say investing in a journalist, particularly a good journalist who's sincere, pays off in the long term. You don't have to buy space in the newspaper. It's a lifelong blessing of education that you're giving the journalist, and they will come up. It's a career advancement for them if you help them understand technical issues. So it's like educating a child, literally, almost. It's a real good thing.
And really quickly, it's not a perverse, selfish goal that we don't want. No, hold on. It's because it's not about journalists. It's about the readers.
Let me just add something. I think you have a point when we communicate some concepts. That's true. We have to be better trained. And that's why I use I don't know if you were here for my presentation, but that's why I use the example of the InfoVacina group, because that's a group we created in Brazil actually, not we, I was part of it, to make journalists be prepared and trained to understand the vaccination concepts we need to better communicate. And I think it should have with epidemiology or public health, or maybe if you are talking about development and problems that are related to early childhood development, we can all get trained. I think that that's a very good point. But the thing about media is that we are not always covering the same subject. So we have to change from covering immunization to one day, to covering floods in the other day, to covering climate change in the third day, to covering elections, national elections the fourth day. So we have to change all the time. So sometimes you don't have time to give the attention you think it's best for one subject. We have to give sometimes portions of subjects, portions of attentions. And we have to sparse it throughout the week with politicians and economics and all the other news that come out. So I understand that sometimes there's a frustration. I've seen with a lot of experts, frustration. Oh, but you come here and you just barely scratch the surface on my research. Yes, but you know, we are already juggling with other 5 or 6 subjects. So that's the best we can do. So if you feel your research should be better communicated, we should work together, as Jaya was saying.
Oui, je voulais compléter, Anna. Au fait, la pandémie de Covid-19, je pense qu'elle nous a donné une leçon en tant que journaliste et en tant qu'également scientifique, parce qu'il y a beaucoup de choses qui se sont passées. Anna venait de le dire, dans nos médias, la plupart des fois, on touche à beaucoup de choses, on couvre beaucoup de choses et c'est un problème. Et il y a des rédactions également qui ne s'intéressent pas aux questions scientifiques. Je peux être dans ma rédaction, je propose un sujet à mon rédacteur en chef, il te dit non, on n'a pas beaucoup trop besoin de ça, on s'intéresse beaucoup plus à cette question. Et donc c'est un problème dans nos médias. Et donc quand vous voulez peut-être vous adresser aussi à un journaliste, il y a des médias actuellement spécialisés sur les questions des sciences qui ne couvrent que la science et pas d'autres questions. Donc ce sont ces genres de médias qui peuvent vous être utiles parce que ces médias priorisent la science dans tout ce qu'ils font. Mais quand vous allez dans des médias généralistes, ces médias ne vont pas vous donner toute la place que vous voulez parce qu'elles ont ce que nous appelons leur ligne éditoriale et ils doivent tenir à leur ligne éditoriale. Mais quand vous allez dans des médias spécialisés sur les questions de la science, là vous allez vous sentir très bien épanoui.
Yeah, so, yeah, why not? Why not?
Thank you. I think I've learned a lot today, so thank you so much to everyone on the panel. I think we talked a lot about just individual actions, like what can we as public health professionals do? Maybe my question is like moving one level up as an institution, like organizations like the Ministries of Health or partner organizations, the international, local, community level organizations. What can we do as a collective to engage with the media, or like what are the best practices there? Because I maybe this is just very anecdotal, but I don't think a lot of partner organizations even proactively engage with the media, or Ministries of Health probably have one communication liaison person and they're probably not trained in immunization. So what can we do more than at the individual level? Thank you.
Well, first, Jaya said it very well. Read the news. Find out who's writing about the topics that you are interested in. Support your local media organizations because they're going through a crisis. Get close to organizations like Internews or others that support local news, and speak to them and start cultivating a relationship that is going to translate into a positive exchange of information, of stories, of ideas. I don't know.
Yeah, so as I said before, we as journalists, we are covering a lot of subjects at the same time, sometimes 6-5 themes at the same day. So we don't keep up with all the research that's coming out. One thing that I think helps a lot is the media relations in your own institution, because they are going to reach out for us. I mean, most of the time when we got contact with a media relations person, it's not always we are going to be interested in reporting, because it's not always something that, as Jaya said, touches the audience, works for them, is important, not always. But when we create this relation, when the Media Relations Institute, in your institute, reaches to journalists, we can have that, oh, I remember that one day I got a call from the Media Relations Office of the University of São Paulo, and they told me they were working on that vaccine. So now I remember, and I'm going to say, can I go and see how the vaccine is developing? And we can maybe report it in firsthand. So I think this is something that's not usually very built in all institutions. Sometimes there are amazing things that are being made, and we don't know because the institutions doesn't go out and reach journalists. So it's hardly going to reach the main audience.
And the point of reading what's in the news is that you'll realize, for instance, what official sources are saying about a certain thing. And then you can call a journalist and say, hey, I read your story and I read you were publishing about, you were saying this. I have some information that might be useful for you. You can be great sources because you are generating knowledge that informs policies. In the end, those policymakers and decision makers are going to read those stories. I mean, we have examples of journalists participating in some of our programs at Sabin that reported during COVID, or they generated in-depth stories, in-depth investigative stories, in one of them in local languages in Uganda, and somebody read it from the government, and it was very simple. And there wasn't enough information in local languages, so they switched an implementation tactic that, in the end, made them look good. But that's the thing. You need to figure out your purpose, what your motivation is going to be, and cultivate these relationships. Now, that doesn't mean that the journalists, are going to be your friends. That takes many, many years. It's a relationship in which we are, feeding each other's needs, and ultimately, it's the truth, right? It's to mitigate the impacts of misinformation and disinformation, and that should be something that we should all pursue.
Can I respond to? It's a tricky question about the institutional media outreach mechanism. The first response, like when we tried to get something going with the National Institute of Epidemiology in Chennai, for instance, they wanted to stay away from the media. Even the National AIDS Control Organization, when Sujata Rao was the DG, they said, why do we want the media? Why do you want a media desk? This is for a program which completely, the bulk of it relied on public communication and education for people to adopt safer behaviors. They just didn't want the news media around. So I think it's an internal decision you have to make about how much money you're going to invest in it, if you're going to have a comms officer or a PR trained person, and then what that person is going to do all day. This was Sujata Rao's question, like a typical bureaucrat who had to organize the finances. Do they have enough work? Can they come in like every Monday? And then what is it that you want to present? Like, how do you want to brand your institution? What is it? What is your public communication imperative maybe for the next 2 years you want to push something? So you have to make these organizational decisions about investing time, money, and effort into setting up this thing. If you're a public health institution one of whose ideals or mandates is to educate your community, it's worth investing in it if that's one of your primary things, or it's your ideal. Ideally, you'd like to do that. Then you'll have to find the money, look for money from Gates or from, all the Soros, the Open Institute. You'll have to create these grants and try and appoint somebody. Call and appoint an advisory committee of journalists, senior journalists from your part of the world to guide you through that, and take it one step at a time. We'll fall down and break our teeth a lot, but I think eventually it's a habit. Then it becomes easy for that office to start preparing talking points when you're coming to conferences like this, jazzing up your PPT, fixing up the interviews, doing your press releases. It becomes a culture that becomes part of your institution. but it'll take a while. You can always observe what happens at organizations like UNAIDS or some of the other, at Sabin, for instance. I mean, talk to Nadia, take her advice about how this happens. But you'll be better prepped for damage control later, managing a publicity crisis also. So I personally, I would argue strongly in favor of a good comms officer. It'll be a big headache off our heads as journalists about like who to reach for what. And it'll also be better for you, I think. All the best.
We don't want to deprive you from tea. So I want to thank Jaya, I want to thank Patrick, and I want to thank Anna, and I want to thank all of you. We hope that you speak to journalists, that you read your local news, and we will meet again. And maybe when we ask you how many of you have engaged with media, all of you will raise your hands. And thank you so much.